Hello, my name is Renee, and I am a transgender patient of Dr. Amy Perlman at the University of Iowa Hospital and Clinics. I am making a video today to talk to you all about my experience with recovery after the orchiectomy. In my first video, I discussed what to expect with the orchiectomy from beginning to end and what that process looks like. Today's video, I am going to share with you all my personal experience during recovery of the orchiectomy. Directly after surgery, I felt a mild burning sensation down below. On a scale of 1 to 10, I would say it's about a 2. 20 minutes after surgery, it felt like having been kicked very hard in the testicles. The pain had increased to about a 3. 1 hour after surgery, swelling and tightness was present. The phantom testicle pain was worse at more like a 3 to a 4. As I live a ways from Iowa City, we went and got lunch afterwards. I had to go pee, so we stopped at a store and I ended up walking the whole length of the store to get to the restroom. That was a very bad idea. I was visibly limping. Each step hurt. I recommend going to the bathroom before leaving the hospital because you will not want to be walking around in public right after the surgery. So with twilight anesthesia after surgery, I was still very alert. I could remember what had happened during the surgery, and it took a little bit for that anesthesia to wear off. So with those first few hours, I kind of started feeling more foggy in my head. I started feeling tired after the first couple of hours. Overall, I thought it was a good experience, and I'm very happy that I went with the twilight anesthesia. About 7 hours after the surgery, having had a couple short naps on the trip home, having iced, I was able to keep the swelling down for the most part. When I got home, I found the most comfortable position was reclining in my chair. I found that during this time, the pain on my right side stayed solidly at around a 4. The pain on my left side was not nearly as bad and was closer to a 3. I went to go lay down in my bed. I am a side sleeper, and I found that side sleeping after the surgery was not really feasible. I did lots of maneuvering, lots of trial and error with a pillow between my legs, and was finally able to go to sleep on my side. I took a 4-hour nap, and when I woke up, I was incredibly sore and tender. I was at a 4 to a 5, the most pain I had been in all day long. I do not recommend sleeping on your side, even if that is what you're used to, even if you use a pillow between your legs, because it did not feel good waking up from that. I do recommend sleeping on your back if you can, and even maybe sleeping in a more reclined position if it's comfortable for you. I woke up the next morning at 6 a.m. I slept very well throughout the night. I was not going to the bathroom nearly as often. I feel like maybe I was a little bit dehydrated, so I would recommend making sure you take plenty of liquids in. Pain that next morning was about at a 4. Again, the pain on my right side was still more intense than the pain on my left. One thing I realized after that first night's sleep is that I was going to want to start setting alarms to wake up in the middle of the night and stay on top of the Tylenol, ibuprofen, and ice. And I would recommend you do the same. The morning after surgery, I felt like I had a lot of gas, and that was causing a lot of discomfort down below. I was able to go to the restroom, and that felt amazing and released a lot of the pain that I was feeling down there. I took a sponge bath late morning, and I cleaned up all the ink that was written on me. I sponge bathed my legs and my thighs and the surgery area, and got off all the markings that were down there, the antiseptic that was still down there. The scrubbing kind of made my skin feel raw, but the trade-off of feeling clean was worth it to me. I took another 4.5-hour nap in the afternoon, and when I woke up, the pain was less at about a 3, and I was feeling much more refreshed, much more like myself than I had when I woke up this morning. I took another 4.5-hour nap in the afternoon, woke up, the pain was only at about a 3. By the end of this first day, at about 9:30 p.m., the pain was feeling more constant at that level 3. The swelling wasn't nearly as down. I was able to stay on top of the ice and the medicines, and it was more of just like an internal soreness down below. The second day after surgery was not nearly as eventful. I started to feel more of just like a general soreness down below. The pain was only at about a 2. I noticed that the bruising was starting to darken a little bit more. I took fewer naps that day. I did start feeling like my head was maybe a little bit clearer from the anesthesia wearing off, but I also felt almost like a depression kind of coming on. I don't know if that was kind of a side effect of the anesthesia finally leaving the system, or if it was because I had just been sleeping so much over the past 2 days, and that was starting to kind of get to me mentally. I do like being physical, so just having to sit and not do much was very difficult for me. So day 3 was Monday. I was heading back to work, and when I woke up that morning, I still feel like the pain was worse on the right side than the left, substantially so even, and the swelling was even more on the right than it was the left, and so most of the icing was spent on that right side. So my job contains both like office work, kind of sedentary work, as well as more movement and standing at a computer, walking back and forth to different stations. And the first half of Monday I spent in my office, kind of doing computer work there. Things felt like everything was calming down. I was able to sit, cross my legs. That felt really comfortable. So after lunch, I did have to do some more demanding work. I was walking around quite a bit, doing a lot of standing. At about 1.5 hours, I could tell that the swelling was getting worse, and there was starting to be a bit of a throbbing pain. After about 2 hours, the pain and swelling was so bad that I was almost in tears from it. I have a high pain tolerance, so this surprised me, but also just goes to show how painful it was at that point. So I left work at 4 o'clock and went home and iced for a solid 6 hours. Again, this is my experience. This is not what is recommended. I did find out later after having talked to a nurse that I had been over-icing the area, and that was kind of causing some issues with the healing. On the side of the incision, that still felt fine. Throughout the entire recovery, the incision spot didn't hurt at all. After the surgery, they give you stitches as well as put a Dermabond on there, which is like a type of glue. By this evening, that was starting to peel and flake off, and I ended up taking what was left of it off that evening. By the end of the day, I was feeling almost like I was back to where I was on day 2. Bruising was getting worse, but the swelling had come down. Tuesday morning when I woke up, I was in too much pain to go to work, so I did not go to work. I had wished that I would have taken Monday off and had that day 3 to stay home and recover some more. The inflammation and swelling was not nearly as bad as it was on day 3, but it was still higher than it was on day 2. So I went ahead and took a hot shower and massaged the muscles on the right side because that's where most of the pain was located. And I felt like that helped quite a bit with that. Throughout the rest of the day, I intermittently did ice pack as well as heat to kind of keep those muscles on that side loose. I did end up calling the on-hand urologist because the fact that the right side hurt so much more than the left kind of started to concern me a bit. And he told me that it is not abnormal for one side to hurt more than the other because technically you're having 2 procedures done, and the way one side heals as opposed to the other may be different. The on-call urologist also suggested that I take more ibuprofen as opposed to Tylenol, since the ibuprofen was going to focus more on the pain caused from inflammation. So I was not very tired on day 4. I was mildly active, did some laundry in my chair, watched some TV, and just kept taking my medicine and icing. So Wednesday, day 5, was the most painful day up until that point. The pain was at a solid 5. The right side of my body was still in so much more pain than the left, but I was tired of being at home, so I went into work and worked about a half day. And afterwards, the swelling was ridiculous and the pain was almost unbearable. When I got home from work that day, I felt lumps in the area around my groin on the right side, and almost one long swollen tube is what it felt like that was sticking up against the incision point, and I could see it poking against my skin. Because of this extra swelling and these lumps that were forming, I ended up icing almost non-stop from the time I got home till almost 7 or 8 o'clock at night. That night, at about 7, I reached out to the on-call urologist again. Unfortunately, he was busy, but I was able to speak to a nurse, and she told me that it sounded like I had been over-icing down there, and that was interfering with my body being able to heal properly, and I had been over-icing and possibly damaging my skin and causing the muscles to get very tight down there. Thursday, day 6, was very similar to day 5. I called the on-call urologist again that night and told him what I was experiencing. He said that he could prescribe me some muscle relaxers, that might help with all the discomfort down there. But he had also explained to me that after surgery, it's possible that you hold fluid, like retain fluid, down where the testicles were removed. I found out later on that what I was experiencing was most likely a seroma, and because of all that fluid in there, it does end up feeling like there's a lump or something solid down there. So Friday, I was able to get my muscle relaxers. I picked those up after working a full day at work, and from Friday evening all the way through Saturday, Sunday, I just took the muscle relaxers as prescribed. They made me very sleepy, so I slept pretty much the whole weekend. The side effects that I experienced from the muscle relaxers was very, very dry mouth, and I had to make sure that I stayed on top of my liquids and stayed on top of my other medicines. Monday and Tuesday, day 10 and 11, work was much better. I halved the dosage of the muscle relaxers throughout the day because I knew that they made me very sleepy, and then I would take a full one when I got home. I was able to see relief from the swelling and ended up stopping completely with the Tylenol on day 11. So Wednesday, day 12, I woke up and felt like I was almost completely back to normal. I still had the lumps or the seroma down where the right testicle had been removed. And although that lump was still present, there wasn't as much pain or swelling around that. It was more of just a discomfort, and every now and again I would kind of feel it move or poke in the wrong direction. I decided that I was no longer going to need or be taking the muscle relaxers or the Tylenol, and I just stayed on a smaller dose of the ibuprofen to deal with whatever remaining swelling was around the seroma on the right side of my groin. The seroma that I had developed on the right side of my groin did end up almost completely being absorbed after 30 days, and by the end of 45 days, there was nothing left down there. I could feel nothing, there was no discomfort, and it had completely gone away. So, to kind of sum everything up and to give you all maybe a list of tips on things I wished I would have done differently so that my experience would have been better, I will go over these. Do not expect this recovery to just be a weekend-long thing. It is not uncommon for it to take up to 2 weeks before you're feeling back to normal. I had done a lot of reading and research before, and I'd heard tons of stories and read a whole bunch online to where everybody said it was an easy weekend recovery. I was back to work just like normal on Monday. That was not what happened for me, and you should just be aware that it may not be what happens for you. Even if you live far away, and maybe especially if you live further away from the university, do not take this day to spend time in Iowa City. I recommend you going home and getting into a nice, comfortable position to begin your recovery in. Make sure that you have your Tylenol and ibuprofen ready for your regular dosages, and set alarms to wake up in the middle of the night to take them. Do not over-ice down there. It may feel good momentarily, but in the end, it can cause more problems for you. Just because you start feeling a little bit better does not mean you should start full-blown back onto your schedule. Take it easy and do not overdo things. If you do, you will delay your recovery and you will cause yourself unnecessary pain. When you have an orchiectomy, you are having 2 testicles removed, Recovery on one side may be different than recovery on the other side. Developing a seroma after any surgery is possible. If you start feeling lumps down there, or you're being told that maybe there's retention of liquid, then it is very possible that you have a seroma. They will go away, but it may take weeks or months for them to disappear completely. And finally, congratulations! Enjoy it! You have gotten through this next step in your journey. Thank you for watching, and if you have not seen the first video that I made regarding what to expect before, during, and after the whole surgery process, please do that, and also watch some of the other great videos that are on this channel. Thank you.